Hi, I'd like to chat with you today about breastfeeding your newborn baby. In nature, mammals feed their newborns milk from the mothers right after birth, and we are no exception. So I'd like to address the fact that there are many misconceptions about human milk. One of the most frustrating misconceptions for both parents and caregivers is that your milk magically appears immediately after the baby is born. This is not true, and unfortunately, this myth causes much unnecessary stress to newly delivered parents. After the birth of your baby, your milk will come in approximately 3 days after a vaginal delivery and approximately 5 days after cesarean birth. The time difference is due to hormone levels associated to the mode of delivery. With a vaginal birth, your levels of hormones that signal your body to start producing milk and the hormones that help you bond with your baby are higher than when you deliver by cesarean section. There is only small drops of golden or yellow liquid called colostrum available, which is all the baby needs at this point. It can be expressed by hand or removed by your baby through feeding right after birth. In obstetric circles, colostrum is fondly known as liquid gold because it has all the nutrients your newborn needs at birth, such as proteins, vitamin A, B12 and K, and energy and essential fatty acids and proteins. Colostrum also downloads immunity from the parent to child, such as immunoglobulins, antibodies, and good bacteria. Once your milk fully comes in, there will be water, lactose, and more vitamins and nutrients added to the composition, all for the benefit of your hungry and growing newborn baby. Breastfeeding is a supply and demand relationship, and most newly delivered parents should be able to breastfeed. Your baby will demand food, and your body will supply milk on demand. As that supply and demand relationship gets stronger and becomes more established, you will find that your body's response to your baby's dietary needs will be faster and hopefully be an enjoyable time that you spend with your baby. Another misconception is that breastfeeding should be easy right from the start. Breastfeeding is natural. Mammary glands are designed really well to produce milk in response to birth. But natural doesn't always mean easy, although it can once you get the hang of it. Feeding your baby is a learning curve for both of you, so be patient with yourself and newborn. Your baby is learning how to get nutrition for the first time outside of the uterus, where food acquisition was automatic. And you are learning how to feed your newborn from your own body, maybe for the first time if this is your first child. This is a body that has just grown a human for almost 10 months and then birthed that human life. You're going to be more than a little tired and likely overwhelmed by all the changes that you've just encountered. So, if you don't feel like you've completely understood how to breastfeed for the first couple days, that's okay. It'll come. Snuggle with your little one skin to skin, sleep when the baby sleeps, eat well, and be kind and patient with yourself. Now, there's a wealth of information available about breastfeeding, especially on topics like how to fix issues of breastfeeding, like flat or inverted nipples or tongue ties. I won't be covering these types of topics here because I don't want to overwhelm you, and also because these are issues that take time to explore. They should be discussed one-on-one with your midwife. However, the one piece of information that I really want you to know about today is about the baby's latch. The term latch refers to the placement of the breast into the baby's mouth and the position of the baby's mouth around the breast tissue and nipple. A correct latch of your baby to your nipple and your breast tissue is vitally important, as it will maximize effective milk removal from your breasts, helping to establish the supply and demand relationship, as well as prevent pain and discomfort and frustration for you and your baby. Since a good latch is effective in removing milk from the milk ducts, it is consequently also instrumental in relieving issues like engorgement and preventing painful blocked milk ducts. Another common misconception is that the baby needs to suck on the parent's nipple in order to eat. This is untrue and leads to ineffective feeds that leave your baby hungry and cause damage to your nipples. I like to compare the nipple to being a straw. There's no actual milk in the nipple, but it's connected to where the milk is. Your baby's effective sucking motion will milk the milk out of the breast, through the nipple and into her mouth. I'll show you what I mean. When feeding your baby, you should be seated comfortably in a well-supported position. Breastfeeding a newborn can take the better part of an hour, and you will need to be comfortable. You may hold your baby in a cross-cradle position, something like this, which is across your body with baby's head facing towards the breast on the opposite side of which you're holding the baby, or in a football position like this, where the baby's head is facing the breast on the same arm as you are holding the baby, and baby's body is tucked around the same side of your body. The football hold is commonly used by parents who have delivered via cesarean section and cannot comfortably rest the baby on their abdomen. There are a few other breastfeeding positions, but these are two of the most common ones. Once you are in a good position and comfortably holding the baby, bring the baby to your breast with baby's mouth opened wide like they are yawning and their lips splayed outwards like a fish. To accomplish this, you can touch your baby's bottom lip with a finger or brush it against your breast, and they will instinctively open wide in anticipation of a meal. The bottom lip of your baby should be resting on the bottom of your areola, wet side of the baby's lip to your dry skin, and your nipple should be in the back of the baby's mouth along the roof of their mouth. Your baby's chin should be resting comfortably on your breast, and their top lip should be open wide and almost covering the remainder of your areola. You will know your baby is drinking effectively when you hear sucking, swallowing, and breathing sounds in a rhythmic pattern. Often there will be 2 to 3 sucks to fill his mouth with milk, and then a swallow, and then the sound of your baby taking a breath after the swallow. Sore or cracked nipples are a sure sign of an ineffective latch, and unfortunately are often the reason breastfeeding parents stop after a short time. If you do encounter this, you should contact your midwife for care. It's a situation that can be remedied with a little help and some simple strategies. So the question I'm often asked is, how do you know if your baby's getting enough milk? By the wet diapers. You will know something is going in when something is coming out. Breastfed babies will eat every 2 to 3 hours, and they will also have a wet diaper at every feeding time. Since breast milk is pretty perfect for the baby's needs, there will not be a lot of waste, and their stool will be liquidy and mustard yellow in color. Lots of wet, liquidy, mustard yellow diapers are a good sign that the baby is getting what they need when they are feeding. And how do you know when your baby's hungry? Often people unfortunately think that the baby's hungry when they cry. Sadly, by the time the baby cries, they are more than hungry. They are cranky and hungry. We always want to try and catch those early signs of hunger before it turns into an all-out wail, and the baby needs to be calmed down again before they will latch well enough to feed. The early signs of a hungry baby usually occur before the baby even wakes up. A sleeping baby that's approaching mealtime will start to turn her head to the side, lick their lips, and put their hands to their mouth. Secondary signs of a hungry baby are that they start to make sounds and move in their sleep and get a little bit fidgety. By the time they start to cry, they're saying, "You have missed my first 2 cues for hunger, and now I'm upset." So it's important to always try and catch that first early cues in order to have a good feeding experience with your newborn. Now, although I said that babies will breastfeed every 2 to 3 hours, please note that some babies will be ready to feed more often than that. Babies are creatures of survival, and they will eat when they are hungry, not according to our clocks. So the best way to avoid hungry baby meltdowns is to feed them on demand if they're showing you cues that they're ready to eat. The final thing I want to inform you about is cluster feeds. I know I've given you a lot of information today, but I only mentioned this last item because I think it will save you hours of needless worry. There are periods in a baby's development that they will be needing more nutrition in order to achieve the next level of development. When this happens, it's called a cluster feed, and the baby just eats constantly for almost 2 hours straight, sometimes every evening from 7 to 9 or from 9 to 11, whenever time the baby has decided that this is their clustering time. This will be taxing on the breastfeeding parent, and you will need extra support at this time at home, but it's not abnormal at all. It's very instrumental in helping your baby grow. Remember I said that babies were creatures of survival? The cluster feed is a necessary tool for their survival, and they will do it instinctively. Finally, congratulations on your newborn child. May the hours you spend together, whether feeding or even just snuggling, be warm and enriching for both of you.